This is breast. And this is a supplementary nursing system, or very short, SNS. This clever little device gives us the opportunity to supplement whilst nursing on the breast. And there are many, many benefits while doing so. One of the main reasons is to keep baby on the breast and not introduce a bottle at all. We can also utilize it to give baby medication if needed. There are obviously opportunities for top-up feeds that can be offered, and you can make sure that baby can practice their latch whilst you have a level of monitoring how much milk they are consuming on top-ups. There are various different systems that all do the same thing. This one is the Haakaa one. Let's talk about on how these two come together. In this particular system, you start off with a bottle like this, and this bottle has a larger opening. So when you are trying to put the larger part of the tube through the teat, it slides in a little easier. Make sure that you're going all the way down with the tube. And this large end then turns into a much smaller end. Now you will require tape or a band-aid. I prefer the band-aid as the tube can go through here, and if you are planning on doing lots and lots of SNS usage, I believe that you do not have to take it off for a whole day and can keep sliding the tube in. Now the band-aid gets put on the breast like so. And a small part of the wire comes through and attaches to your nipple like so. You can place it above, on either of the sides, as long as baby is taking in the tube and the nipple and feeds from both of these devices. The placement is all yours. In order to control the flow, you can move this little wheel up and down and speed up or slow down how much milk baby can receive through the tube. And as baby is consuming the top-up milk and is remaining on the breast, baby gets to practice their latch, they get supplementation, they can have medication, and you get to monitor growth and process whilst not introducing any other systems such as a bottle. And as per usual, it is always important to work with an IBCLC to figure out the exact steps of why you are introducing the SNS system and how to correctly use it, look after it, and what to look out for.